Kiruhura is one of the districts choking on COVID-19 case upsurge in Ankwale sub-region. The situation has been exacerbated by patients who opt for traditional healers rather than established health centers.
Not all people are religious. There are issues that people are bewitched. We have no control on that.
Since the last 1 month, because you find someone of COVID thinking that he's bewitched and he goes there.
Because these the traditional doctors, they don't diagnose the disease, so they don't treat what they know.
It is reported that whenever a person gets COVID-19 signs, the first option is traditional healers until their conditions worsen and are taken to health facilities for specialized treatment. According to area leaders, this is what has increased the spread of COVID-19.
But I attribute it basically to illiteracy and ignorance. You know, my people are semi-illiterate, and those who are illiterate believe in witchcraft. So when somebody gets sick, instead of going for medical treatment, for testing, see whether it's malaria, whether it's COVID, or whether it's what, the first thing that comes to their mind is to go for witchcraft, to go to those herbalists, to go for those traditional healers. So it's a big problem.
Residents reportedly use district ambulances to transport them to these traditional healers.
For those people, we are going to prepare these ambulances ready for use. But when it comes to fuel and facilitation, it is the individual, as of now. So that one should also be clear to you.
Reports also indicate that a good number of people are dying of COVID-19, but their families and relatives continue to bury them quietly without following COVID-19 burial guidelines. The district task force has now launched a surveillance team to investigate all unreported sickness and deaths with the aim of establishing the truth.
Because our people die from elsewhere, they are not managed by our health facilities. But even if they die from Kampala, when they come for burial in Kiruhura, the district team, surveillance team, should pick an interest and go and test those as contacts.
Kiruhura district has so far registered 234 COVID-19 cases, including 10 health workers. Among these, only 12 patients have sought treatment from the district health facilities, with 2 succumbing to the infection. The district leaders have also suspended the operations of the district administration to the public until further notice.
That means, on record, many of the services people expected are going to be somehow suspended quietly. So people should not complain to the chairman, the other DC, that this one is not taking place. We want to see how best we can save life and we can save the spread.
The health workers in Kiruhura district have been operating without adequate personal protective equipment, which has subjected some to contracting COVID-19. Area leaders have, however, come to their rescue.
But we continue to appeal that these people exercise standard operating procedures, follow the guidelines, test when they suspect that they are not feeling well.